What is FASD and who does it affect? FASD, or fetal alcohol spectrum disorder, describes a range of disorders resulting from irreversible brain damage caused by maternal alcohol consumption during pregnancy. The symptoms can vary from mild to quite severe and have lifelong implications. In this presentation, we will discuss some of the potential symptoms and challenges faced by affected children, as well as the typical interventions that are needed. FASD is an umbrella term that includes several disorders. These include fetal alcohol syndrome, alcohol-related birth defects, fetal alcohol effects, and alcohol-related neurodevelopmental disorder. Out of these, fetal alcohol syndrome is by far the most severe and visibly recognizable. Where do symptoms show up, and how does it affect the child? There are many physical ways in which FASD can affect a child. Some of these include a smaller head size, shorter than average height, low body weight, unusually thin upper lip with a smooth ridge between the nose and lip, poor coordination, and problems with vision, kidneys, hearing, heart, and bones. Although the range of physical symptoms can be very problematic, the behavioral issues can be even more challenging. For instance, these children are often diagnosed with ADHD first due to their struggles with attention, hyperactivity, and lack of impulse control. They are also easily frustrated and can have profound difficulties with language and speech, memory, and learning, especially in the areas of math and reading. The challenges and difficulties of having FASD does not just relate to the developing child and adolescent years, however. Its effects can be seen over the course of the person's entire lifespan. For instance, it can lead to a greater risk of mental health problems, trouble with the law, inappropriate sexual behavior, drug and alcohol addictions, challenges with independent living, and finding and/or keeping a job. When and how is FASD diagnosed? Currently, there is no simple test to determine if a child has FASD, and so receiving a proper diagnosis can be challenging. However, since the disorder's impact on mental, social, and physical development are so large, an early diagnosis is crucial so that the proper interventions can be put in place in order to minimize the disabilities linked to FASD. According to Health Canada, FASD is usually diagnosed by a team of health professionals, which may include a physician, a psychologist, a social worker, an occupational therapist, and a speech and language therapist. Unfortunately, there is no cure for FASD. However, there are a variety of helpful interventions, both with medications and alternative therapies, that can be very successful and when used together tend to produce the best results. Some examples of medications are stimulants, which may help with lack of focus, impulse control, hyperactivity, antidepressants, which may help with sleep issues, aggression, irritability, and antisocial behaviors, antipsychotics, which may help with hallucinations and/or aggression, and anti-anxiety medications, which may help with extreme nervousness, anxiety, and certain phobias. Some of the most common alternative therapies used to treat the symptoms of FASD include vitamin and mineral supplementation, biofeedback, which is a protocol used to improve brain wave activity, auditory training, exercise, relaxation therapy, acupressure, massage, animal therapy, and art therapy. Although the success of these alternative treatment approaches may vary widely depending on the severity of the FASD symptoms, according to E. Buger and J. Brown, art therapy is proving to be especially promising. This is because of its numerous positive benefits. For instance, in addition to effectively teaching calming, coping, and relaxation strategies, art therapy also increases emotional regulation and grows and strengthens the child's self-esteem. The most important part of any treatment plan is education and behavioral therapy, especially in the area of learning social skills needed in relationships and gaining as much independence as possible. Along with this, education and support for the family and caregivers of the child will be needed for as long as they are under their care. Why is this issue so important? Although FASD is irreversible and brings lifelong challenges, it is also one of the only disabilities with a clear and avoidable cause. The first and best steps for prevention are continued education that brings increased awareness to the high risk factors of drinking any alcohol during pregnancy. Exposure to alcohol during any time of pregnancy can adversely affect the developing brain of the fetus. According to the Ottawa Citizen, 61% of Canadians have an unintended pregnancy. Since most pregnancies go undetected in the first several weeks, if a woman is sexually active, whether she is planning to become pregnant in the near future or not, it is crucial to either avoid or minimize consumption of alcohol.